Hi, guys. Welcome to Open Up. Today I'm joined by an exceptional team of Italian specialists who work together at the intersection of function, health, and facial aesthetics. We have Dr. Stefano Negrini.
Nice to
Dr.
meet
Stefano
you.
Negrini is he's a highly experienced maxillofacial surgeon with decades of experience in facial reconstruction and jaw surgery, helping patients restore both function and confidence through advanced surgical care. Then we have Dr. Luca FERRARI. He's a
Hi.
facial plastic, yes. He's a facial plastic and maxillofacial surgeon known for his work in aesthetic facial surgery and rhinoplasty. Combining surgical precision with a strong focus on natural, harmonious results. So if you want to look naturally beautiful, this is a doctor. And Dr. Carlo Tian,
Hello.
he's an orthodontic specialist who works closely with surgical teams to correct complex jaw and facial conditions, guiding patients through the transformative journey of functional and aesthetic alignment. Now that you met these brilliant doctors, is there anything that you'd like to add up?
Okay. Good morning, everybody. I'm very happy to be here with you, and thank you very much for your introduction. I want to say that I use my experience in maxillofacial pathologies in this our project that is a profile surgery. That means to join the functional and the aesthetic problems of the people. I use my experience as maxillofacial for trauma, for dysfunction, for functional problem to improve the aesthetics of our patient. Okay.
Wow, very interesting. Any type of what kind of project are you guys working on?
Luca, do you want to explain our project?
Yes, of course. Thank you. We decided to work together because we think that great things are never done by one person alone, but they are done by a team of people. So we decided to work in team, and we decided to found in our team our project that we call the Profile.Surgery, that is focused on the correction or deformity of the jaws, and also on the aesthetic of the face, only the face, and like rhinoplasty or autoplasty, or maybe also lipofilling or regenerative medicine. And I'm very proud to work with two guys that are also very good surgeon and very good friends for me.
It's awesome. That is awesome. And what is the link for this project? Like where can people learn about it more?
Yeah, of course. This is www.
And we are going to add it right here.
Okay, thank you.
Yes.
Okay,
And can I jump into some serious questions? Are we
of
ready?
course.
Okay.
Yeah.
To begin with, could you explain exactly what orthofacial surgery is and what are the main anatomical and functional problems it addresses?
Yes, of course. Thanks for this interesting question. Orthofacial surgery is the modern evolution of maxillofacial autonomy surgery. It has no limits itself to correcting occlusion, the way the teeth close, but considers the effect in it entirely. Over time, we have moved from addressing crucial problems considered severe and correcting issue of lesser magnitude, driven also by the strong demand for not just functional but also aesthetic of the face. It deals with correcting disharmonies of the facial skeleton, specifically when the bones of the maxilla, upper jaw, and the mandible, the lower jaw, have not grown harmoniously. These include pronatism or hypoplasia, jaw too far forward or too far back, altered chin position, like for example, facial asymmetries, when the face is deviated on one side, a respiratory issue only, often linked to the airways that are too narrow due to the bone position. This is a typical examples of the patient we treat with our project.
I think I just saw in a story on your guys' Instagram Was that prognatism? There was a story with a surgery and it looked amazing. The after was wow, mind blowing. And by the way, what is your Instagram handle so people can follow you?
It's the same. Profile.Surgery.
Perfect. Yeah, that was fascinating. Wow. And what are the salient points of this therapeutic path? Like, what should a patient expect in terms of planning and management of the surgery?
How do you want to explain about?
This is for me, so okay, I'll answer that.
Okay.
You know, one of the reasons why I work with two guys down here, at least at my screen, is just because we're kind of living in this crazy aesthetic world when everything is just about aesthetics, everything is just about improving something that sometimes just not feasible. Okay. So to me, the most important things is just to work with someone who has an overview of the whole patient, from the head to the tip of the toes. You know what I mean? So to me, the most important thing is just to look at an achievable objective, of course, because you can't just tell the patient anything that you want, or you can just follow anything that the patient asks for just to obtain the perfect. Perfect does not exist in this world. So everything is just to compromise between our way of seeing things, addressing the patient to the right decision at the right moment, because our face at 20 years old is not the same as 30 or 40 or 50 or anything. The most difficult part to address this is just to take care of the patient from the, first of all, a psychological point of view. And then I think it's something like a journey. You just take your patient by the hand and draw him to the right decision, the best as possible. And of course, to give the most results that you can achieve with this.
Wow. Yeah, I like how you said it. So it all starts with the
Yeah,
psychological. Wow, it is so true.
but also for us, I mean,
It's a lot of work.
that's important.
Right. Yeah, that is. And how has it ever happened that somebody was not happy? Like, how do you help them psychologically? That can be,
Hopefully not, not yet.
oh gosh, hopefully never. Yeah. In what way does orthofacial surgery represent an evolution compared to traditional orthodontic surgery? Like, what are the differences in the approach to aesthetics and the overall harmony of the face?
I want to answer to this question because the old school maybe, or the evolution, we pass from orthodontic surgery that is focused almost on the occlusion and an odontocentric vision to the orthofacial surgery that place facial aesthetic and areas in the center to allow the patient not also an improvement of the function, but also an improvement of the aesthetics. And so it's important before many ancillary, that we call ancillary, so secondary procedures, they become primary, like rhinoplasty, or like maybe use of prosthesis of the face, maybe on the zygoma or on the mandible, also the chin. And so it's very important because the patient don't want only to have a good occlusion, but also want to have an improvement of the aesthetic of the face, because the face is our greeting card. And so it's very important.
Yeah. Wow, that was a great answer. Why in certain cases is orthodontic treatment alone, like braces, why are those not sufficient or even not even like advised? And what are the advantages of intervening surgically instead of attempting a mere dental, let's so to speak, camouflage?
I can answer that. It somehow linked, as what I'm saying before. We don't have to forget that we have limits, we have boundaries, we have some anatomical boundaries, and we don't want to overwhelm these boundaries. That's because, as I said before, aesthetics has to join with the anatomy, with function, with anything that lies within this whole stuff. So To me, sometimes it happens, not so rarely. It happens quite often, actually, that a patient come to us that has undergone years, decades, sometimes of orthodontic treatments or anything that was just not useful because the purpose was to overgo that kind of anatomical boundaries. So there is limits in surgery. There's limits in anatomy. As I always say, anatomy is not an opinion; is a fact. Okay, and you have to respect that. So when you have an anatomical limit, you can just promise the moon to the patient. You have to tell him and to be very straightforward. I can go from here to there, but I can't go any further. That is where surgery begins. That is where you have to address the patient to have the right choices.
Very interesting. Dr. Tian, why did you choose this path? You seem very passionate.
That's a $1 million question. No. One interesting thing is to me is just to in my life, I'm 50 years old, so in my life, I've been doing this for the last 25 years. And in my life, I met a lot of different people with different opinions. And it's very difficult to me to find passionate and also very skilled professionals like my friends here. So I think that's I'm a kind of lucky guy, because when you find these guys and you work and you share a common vision of aesthetics, function, anything that goes within this kind of work is very demanding. But the results sometimes, as you already has seen, is just amazing.
What do you guys like? The teeth and but you're just kind of like moving the bones, right?
Yeah, right. The jaws.
Wow.
No.
I would say that in many directions, we move the bones in many directions, in every direction. And as Dr. Tian said, is our passion. When we were young, we decided to do this type of work, and we love it. Also, I am 60 years old, and I like my job like the first day or much more.
Wow.
Yes, of course. And for
That's
us, is a great opportunity to lead this project, because both of all of us, we the same position about our job, our work, our profession. So
you've done it for so
I find
long.
it's very important, this aspect, to gain great objective, great goals.
That's amazing.
Yeah.
And Dr. Negrini, I feel like I need to ask you as well, what made you choose this path?
I started from my when I were very young. I live near to some doctors, and when I was a student, I started to go in the operating room with some very good surgeon. So I start to love this profession, and then I have the opportunity to practice this type of surgery, maxillofacial. So I start from the beginning, and then I learn from many people, many surgeons in Europe, not only in Italy. And so I think that all this aspect make me to be this type of a person, to this type of surgeon. Yeah.
It's fascinating to me.
Yeah.
Yes. I also want to know, is this for the long-term benefits of the surgeries and all that? What are the concrete benefits, both functional, which we know it's the breathing and chewing and all, and the aesthetic that orthofacial surgery offers compared to more conservative alternatives? What are the benefits?
Who wants to answer this?
So
Stefano, do you want to answer to this question? Of course, long-term benefits.
yes. Okay. So, okay. Yes. Yes. The benefits are transformative, at least at lifetime. We have some functional aspects. The biggest benefit is on the sleep apnea syndrome, because by advancing the jaw bones, the posterior airways open up, allowing the patient to breathe, sleep, and oxygenate the brain, also the heart, better. Furthermore, food, it is a debated topic in literature. In my clinical practice, there is an improvement in temporomandibular joint dysfunctions. For example, in the case of coexistence of joint problems associated with severe facial deformities, the correction of these defects turn out to be mandatory compared to joint treatment alone. And then also the aesthetic and psychological aspect, because the golden ratios of the face are restored. So the leads of the huge increase in self-esteem. The face always represents our first business card. Jean Cousteau said a defect of a soul cannot be corrected, but a defect of the body, if corrected, can heal the soul. So it's very important for us, this type of philosophy. And also, of course, the anti-aging aspect. Correct skeletal support tenses the soft tissue, making the face age much more slowly compared to someone with a deficient bone structure. Today, in fact, some surgeons have coined the term of reverse facelift to speak of a lift that does not start from treating the soft tissue, skin, subcutaneous tissue on the face, with the repositioning, but gives tension to the soft tissue by repositioning the facial skeleton. This is the much more important aspect of this type of surgery.
Wow. I'm still trying to process a defect of the soul cannot be corrected,
Yes,
but
very
a defect
beautiful.
of the
Yeah,
body.
very
That
beautiful.
is interesting. So that means the beauty is from outside in.
But also inside, outside.
I've always thought it was from inside out.
Yes.
Wow. And then I need to get some surgery. I need to see you guys
No.
in that case.
Can I add only some? I think that when we think about our team, it's important to have also other specialists in this kind of surgery. That's very important. Also, the anesthesiologist team, because it's a dedicated anesthesia for this kind of surgery. It's useful to have an hypotensive and to reduce the edema and the swelling in the post-op. And also, we also have my functional therapist or speech therapist after surgery or physiotherapist, and also psychology to aid the patients maybe in the pre-op or post-op. And we think that to complete the team or our philosophy, and also this kind of surgery, maybe in the past, it's heavy surgery, but now the techniques and other change. And so we can reduce the surgical access that is called minimally invasive surgery. And also we have less swelling, and we have use maybe the device like a piezoelectric device, and also isothermal therapy in the post-op. And so we can reduce the swelling and the post-op of the patients.
Wow. Yeah. So that you guys have a big team then. A lot of people.
Yeah, of course. I think that it's better to have a big team to perform some kind of surgery.
Yeah, such a life-changing surgery. And Dr.
Yeah.
Ferrari, yes, since I've known you since I was a kid, but I never asked you this. Why did you decide to become a doctor?
I don't know, maybe it's a lot of things, but at the end of the high school, I'm not so decide to become a doctor, but maybe after, maybe for the family, or maybe because I know that I wasn't scared by blood, and so it's also important to know. Yeah, it's important to not scare, but maybe it's different when I decide to become a surgeon, because I think that it's different. Maybe when I meet this kind of surgery, when I think that I was at third or fourth, five of university, I know this kind of surgery of the face, and so I love it because I think that I like very much when I can perform a surgery on a patient, I can see the results. And so I like it to see my results on the patient. And it's important to hide the patient because I also like to perform other surgery, like for craniofacial surgery when in my training, and also for cleft patients. It's important. It's like a circle. Surgery is always surgery.
And I don't know if you still remember how self-conscious I've always been about my broken nose.
Yeah.
What makes somebody like, should I get this fixed, in your opinion? Because it's different. When you look at the right side, it's completely different from the left.
Yeah. It's normal when you broke your nose. Maybe.
I've been trying to convince myself not to, but I don't know. Maybe one
You
day.
don't know now. Think a little much more.
Yeah, maybe I'll come see you in Milan.
Okay.
But I have some questions from the audience. Each episode has a segment where I include my audience, and I have a question for each of you. And you decide whoever wants to answer which one. First question is from a friend of mine, Jeremy Davis. He's a former NFL player. He played for New York Giants, LA Chargers, and Detroit Lions, if you know American football. Is a pretty big deal. His question is, what mental practices do you have when it comes to emergency surgery to stay calm and in the moment?
If you want, I can answer to this question. But I think that now it comes naturally, of course, but because your calmness, which comes from your inner awareness of your experience, comes now naturally. But at first, however, it wasn't so easy. So I think that this type of position is thanks to your fundamentally from your experience, not from your nature. You can begin, you can transform you in a person, a surgeon with calmness. You have to learn, you have to work very, very hard, but then it comes very naturally.
Very interesting. So it's a matter of practice with
Yes.
time. Very interesting. Yeah. I have a second question from Jaden C. Jones. What does it feel like having someone's life in your hands?
It's like when you have from one side you can feel fear and panic, but he vanish because you have to focus only on the action. Maybe it's very important to maybe have a compartmentalization, and you have not to detach the emotional things, and you have to only like maybe biological puzzle to be solved for the patient. And so I think that you don't have to be emotionally involved with this kind of things, because you have to be very rational to have the best outcome for the patient, and you have to try to don't feel the pressure because it's all on your shoulder if it will go bad, good or not good. And I think that after maybe if you do a good job and the things go well, you feel proud of yourself. But it doesn't, if the things go wrong, it's a bad sensation because the guilt, the grief, and maybe you can also, there are maybe the sensation of a burnout. And also maybe you could have also sensation of post-traumatic stress disorder. And so it's for me, it's very important maybe to do maybe some also meditation before surgery or before maybe going emergency room, and because you have to stay away from everything or everyone. And also maybe I repeat the key point of some kind of surgery, very complex surgery, or that's all. I think that's all. But it's quite difficult.
I can imagine. Well, maybe not. Maybe it's a female thing to overthink stuff, but I would freak out. Do you think you would be a lot more nervous if it was like a loved one, if you were operating on someone?
I don't try this, but I think that it's much more difficult if you're involved with the patient. And so if you love someone, maybe or it's a wife or a child, or it's, I don't try this, but I think that it depends on the surgery. Obviously, for very simple surgery, it's not a problem for me, but maybe for some kind of surgery, I don't know, but I never tried, and so I don't know.
You want to stay away from that.
But it could be more complicated, obviously.
So, doctor, what is the one question every patient should ask their surgeon, but usually doesn't?
That's a great question. To me, sometimes when we talk to the patient, we're just so focused about what we have to, in few minutes, we have to explain this patient a lot of difficult stuff, like technical stuff and anything that goes within this. Because, all this kind of facial surgery require time, require efforts, require abnegation, a lot of stuff going on in few minutes. So we try to concentrate all of this and give the patient the best answer that we can. But sometimes when I finish my let's call it lesson, okay, to this patient, I would like to hear from the patient, okay, doctor, everything is clear. My path you just told me is clear as water. Anything is just go straight forward. I'm ready to go. But is there an option B or C or D or Z, because as I said before, sometimes you have just to match your way of seeing things to the patient's point of view. And we as professionals sometimes just try to forget all these aspects. We're just concerned about the technical aspects or what we have to do to give it improvements or the facial results or anything. But we are talking with people, with a person who has feelings, who has a soul, who has thoughts. This is very, very, very difficult to us to match all these things in just few minutes. So when a patient asks me, okay, doctor, let's talk about plan B. What if anything goes wrong? What if there is some sides that we didn't take in account? What happens? So I understand that the patient is involved much more than from just an aesthetical point of view. Okay, it's involved from within. I don't know if I can transmit this message.
Yeah, it makes
But
sense.
that's what I would like to hear from my patients.
Wow. That is amazing. And I do have so many more questions, but we came to we're at the halfway. So I'm going to try to introduce some games because I know it's late in Italy. So I don't want to hold you guys up too long. And the following game is a rapid fire. So one answer, and we're going to go around, and it's just the one answer. Is going to be really quickly. And we have, I guess, twice. So 2 questions per doctor. Truth or myth? This is the name of the game. And I'm going to read a question and you're going to say if it's truth or if it's a myth.
Okay.
And we can start with Dr. Negrini. Would you feel like starting?
Yes,
All right.
of course. Yes, of course.
Awesome.
Okay.
And then we can go, would you like, how do we want to go? I have you on my screen. I have Dr. Negrini, I have Dr. Ferrari, and then I have Dr. Tien. So do we want to go that way or do we want to, how do you?
As you want.
As you
Like you want, clockwise or
Perfect. And we'll go like that.
Okay.
All right. Having a facelift too early can stretch the skin and lead to the need for additional facelifts sooner over time. True or myth?
True.
True.
Yeah.
Second question. Plastic surgery can fix insecurity. True or false? Or myth?
Meat, false. Sometimes can help, but meat, false.
Okay. Huh.
Yes.
All right. And now, Dr. Ferrari, facial aging is
I'm
caused.
ready.
You ready? Facial aging is caused more by bone and fat loss than by skin alone. Truth or myth?
Truth.
Social media filters have changed how patients see their own faces. Truth?
Truth.
And last 2 for Dr. Tian. If 2 patients have the same procedure at the same age, they should expect similar results. True or false?
False, totally.
Surgical outcomes are determined more by the procedure itself than by the patient's biology and long-term habits. True or false?
I can say actually it's true or false. It's something among these two.
So in the middle somewhere?
Yeah,
Depends.
something in the middle. Yeah.
All right, we go into the next.
Everyone is different, so it's difficult just to give the same perspective to anyone.
Interesting. Yeah, surgical outcomes are determined more by the procedure itself than by the patient's biology and long-term habits. So it does depend on their biology and their long-term habits. So I guess more leaning toward the true side. Mm-hmm.
For me, the surgical procedures, it's important, obviously, but also the patient's biology is very important in the healing process. And so for me, this is a myth, but it's my opinion, only my opinion. Maybe it could be, I don't know the rate, but half and half, but it's only my opinion.
I would say both of them too.
Wow.
Yeah.
You're all on the same page. I love it. That's awesome. The next game would be called Would You Recommend? And it's an ethics game. So we're going to go around and we have 3 per doctor. If you prefer answering 3 in a row, or we can go 1, 1, 1, 1, it's up to you. Whatever it's
As you want.
Well, I guess we can stick to the
What do
way
you
we did.
prefer?
Yeah, we can stick
1, 1, 1?
Actually, sure. Let's do it. We can change it up.
Okay.
Yeah. All right. So
Okay.
the answer would be yes, no, or it depends. Okay.
Okay.
At 25 years old, asking for a facelift. Is it a yes or no, or it depends?
I would say it depends. Only in case of trauma like injuries or birth injury. All in this case.
All right. That's interesting. I never thought, if they have some injury and they need a second question. Someone bring in a celebrity photo that looks nothing like the patient.
Definitely no.
So no? So if I brought Kim Kardashian photo instead, make me look like...
No, definitely no.
But what if I brought a Sophia Loren photo? Like I used to, at least when I was younger.
Yes, I know.
Maybe. All right. A nose job at 18.
For me, it depends. The answer would be much more longer, but as a straightforward answer, it depends.
Mm-hmm. A patient seeking a revision surgery after multiple previous procedures performed elsewhere with limited remaining tissue to work with.
If I to choose, I would say it depends only in case of serious events.
Wow. You basically taken someone's bad work and try to fix it.
Yes.
That is courageous right there. That tells me you're an amazing doctor.
It's a mission. Yeah. The doctor is a mission. It's not a normal job.
Definitely. An 18 years old asking for sex change because his parents want him to be a girl.
For me, it's no, because it comes from his parents, the request to change. But if this kind of requests have to come from the patients. And so if the patient wants to change, there's a part of the orthofacial surgery that it's for the gender surgery of the face that is called facial feminization surgery. And it's important maybe if in the gender surgery. And so if the patient wants to change, it's a question, but if the parents want to come to change, SONA, it's not a good idea. So definitely no.
I don't know. What if the patient is 16 and the parents want him to change? And I'm deviating from the game, but I'm just curious.
I think that it's always no. So it not depends by the age only, but you can determine what do you want to be, or how do you feel, or what do you feel your gender. So it's important, not by the parents. It's not determined by the parents.
Interesting. Okay. I feel like Dr. Negrini has something to add up. I don't know why.
No.
I'm getting that sense.
I was thinking about what Dr. Ferrari was saying. I think it depends of the social position, also on the country. Some other problems linked to the country where you live. Many social position you can think different, but I agree with Luca about this operation 16.
Yeah, I agree completely too. And I'm so happy that we're all agreeing on this. It's a very sensitive topic in America right now.
Yeah.
Yeah.
When you look at someone's face, do you see their flaws? Is the plastic surgeon in you like, dang, I'd like to fix that nose? Or, you know, her chin needs some trimming or something like that?
That's for me.
Yes.
Yes.
Well, yes, depends.
Always depends.
I'm the depends guy here, okay? Because sometimes we just have to think at things in D, not in 2D. We're not Egyptian faces, okay? We're moving faces, and any second your face change expression, you move different muscles, you move your skin, and everything that goes with this. So when you see the faces, you see a skeletal pattern, but also what is the motor that moves in. These are the muscles.
Yeah.
So the game changer here, I'm relating to what we were talking earlier in this interview, is not the partially the bony part, but we care a lot about repositioning muscles, about giving some kind of support to the soft tissues. And this is the real game changer here in this facial surgery, in this orthofacial surgery. Yes, I look at faces, and I would like to move everything that I can for everyone, but this is not possible. So we just kind of try to figure out for the patient the skeletal pattern, but also the movement that lies beneath all this stuff.
Very interesting. Are you, I guess, whoever wants to take the next question, are you planning to open a plastic surgery office in America, maybe in Las Vegas? It's the city. Everybody goes to the plastic
Quite
surgery.
difficult.
Tomorrow,
It's quite difficult.
tomorrow morning.
You would be a billionaire. Yes. And lastly, a patient with perfectly healthy anatomy requesting a drastic change for trend-driven reasons, like whatever the social media trend is at the moment.
No. For me, no.
For me, it depends.
Can we
Carlo?
elaborate?
Carlo?
I won't answer this. I'm not going to answer this.
Because he said yes.
Wow. So I'm going to go with the finish the sentence, which is going to go around, and we have 3 questions per doctor.
Okay.
Short, thoughtful completions, and we can start with surgery can't fix. Cannot fix what?
I take this question. Surgery can fix, I think, inner insecurities.
I feel like I need to give you a standing ovation. It's so true. Oh my gosh. Beauty without confidence is
Me too. Beauty without color is empty, something empty.
like a mask.
Also, always philosophical concept.
An empty mask. Yeah.
Aging teaches us
Aging teaches us, should teach us to live consciously in the present. I think.
love this answer.
Yeah.
Wow. So well. So wow. It's so true. The best results happen when
For me, when the patient is happy. For me, happy patients, happy surgeon. Always.
you should drink or eat this before a surgery.
To drink or eat this before surgery?
Yeah.
No, you don't have to drink anything before surgery.
So nothing. Oh, okay.
No.
A good surgeon knows when to say
No.
very, very cool. Yes. And the last 3, the most important conversation before surgery is, I'll say the most important conversation before surgery is
Stay chill. Join the sleeping and give faith to your surgeon.
amazing. The biggest mistake patients make before surgery is
Maybe to doubt what they're doing, because fear come into the game, and sometimes it makes you not to be so sure what you're about to have. But I just our role in that moment is just to reassure the patients and be very, very, how can I say, we're not psychologists, we're just doctors, but sometimes we have to kind of become a little bit.
That's true.
Yeah.
The question I wish every patient asks.
Well, when all this stuff will end, how can I be myself again?
But now you got to be a shrink. You have to be a psychologist, a psychiatrist, and all of that to answer. Whew.
Yeah.
That's yeah. And although I believe you're all married, or at least two of you, right? But we do have a who would you marry? Let's just say hypothetically, and we can go around. There's just one question per doctor. One would be, who would you marry? A woman with a flawed natural beauty or a woman with perfect plastic surgery face?
Can I answer, please?
Yes.
A woman with flower natural beauty, of course.
So do I. To say.
We're all,
If there is anything that lies between the two of
it's like, I don't want to be left out.
Half and half.
Yeah. A woman who publicly accepts aging but struggles privately, or a woman who publicly brags about being natural but hides much plastic surgery?
Luca.
For me,
Yes.
the second one. The second one.
So a woman who
Yeah.
publicly brags about being natural.
Yeah,
This
but
is
hides much
deceiving.
plastic surgery. Yeah, because I don't like struggles privately.
Okay. Because a woman who publicly accepts aging but struggles privately. Okay.
Yeah.
She's got some mental issues.
Yeah, of course.
And the third question, a woman who is naturally confident but visibly imperfect, or a woman who is physically flawless but deeply insecure?
For me, the first one.
Me too.
Naturally confident.
That's fair.
for me is how confident and how insecure, you know. You have to stay between these two
Goodness.
lines.
I love how, like, you're some shade of gray, Dr. Tian. You're like somewhere in the middle.
Yeah.
It's gotta be something.
Yeah,
I'm a
sure.
very diplomatic guy.
Yeah.
Definitely. Wow. And then we have the final game, I believe, or do we have more? I think this is the final game, and then we can wrap it. Answer with one word. And we're going to go around and we have 3 per doctor. And first question is, the most misunderstood emotion patients feel before surgery?
I would say ascertainly. Yeah. Yes.
One thing patients worry about too much?
And I would say pain. Pain. Yes.
What about one thing they don't worry about enough?
I think is the psychological aspect after surgery.
Is it better to worry about that, or is it better to just kind of put that on pause? I wonder.
Yeah.
Questions for Dr. Ferrari. The hardest conversation you've ever had with a patient?
With one word only?
But you can expand on that.
Complication. Maybe if you have a complication after surgery, it's very difficult to have with the patient because maybe you have to fix something, and so sometimes it's possible. We hope very less case, but you have to remake the surgery or only one part of the surgery, and so it's quite complicated.
Yeah, I can only imagine. One question you wish more patients would ask before surgery, but I guess one word. I guess I don't know how this came into one question, but you can give me the question.
Yeah, what will results be like? I think. Yeah.
All right, that's interesting.
They want to know the results after surgery. It's not so predictable because, but we can try to have some maybe simulation. But it's much more simulation are much more reliable on the hard tissue like bone, but not in the soft tissue. And so we, like a surgeon, could make a provision, but it's not maybe, or it could not be like the final results in the post-op. And so I think that this is the most asked question for me in my practice.
What about AI? Is there no AI tool that can get close to the
Yeah. But the AI is an algorithm, and so it's not predictable because if you advance or if you forward maybe the mandible about 1 millimeter on the bone, it's not like you are not sure that it could be it's 1 millimeter on the soft tissue at the level of the skin. Okay, and so you can have the real prediction of the increase maybe of the skin of the soft tissue.
Unless the AI is making the
Yeah.
surgery, but that's a
it could
bad
be.
move. I would not.
Yeah.
And a last one for Dr. Ferrari, a moment that reminded you this work is deeply human, not just technical.
It's the same about the other question and answer, because for me, maybe when the patient is very happy of the results, and so it's most important for the surgeon, because we are a surgeon because we want to improve the life of our patients, and so that's the most for me human part.
Yes. And, having to deal with all that mental stuff afterward and yeah. And the questions for Dr. Tian. The emotion you notice most when patients see their results for the first time.
Well, that's not an easy question, but I would say happiness maybe, but not the happiness that you receive when a patient smiles at you after all this long journey. Sometimes I see at the patient faces and I kind of try of see beyond the eyes. And so you can feel a very intimate happiness. And this is what amazed me the most when we do this kind of stuff.
Yeah. Wow. They look in the mirror and then they start crying and they're happy. Yeah, I can only imagine.
Yeah.
What a beautiful
But
feeling.
it's not only the happiness in the faces when you smile. It's, as I said, a very intimate happiness, a very deep inside happiness.
The quality that makes a patient a good candidate.
Well, you're asking me a lot of hard questions. Maybe a good candidate, maybe the consciousness of what lies ahead of him.
To just be a positive spirit and think about positive results and outcome. And lastly, the skill that matters most in surgery.
Training, and when you finish, train again and train and train and train, and you never have to be tired, never.
Just always study and always practice, huh? Wow. I don't know if I did not ask you guys, but how do you feel about AI? Are you pro, anti, with it, intimidated by it?
I am pro.
Okay.
I am pro.
I'm afraid.
Absolutely.
Yeah. Good thing you have one that's pro, so then that kind of cancels out the fear on your end. Yes, I can see the mixed feelings. And of course, Dr. Tian somewhere in the middle,
Yeah.
which is amazing. Wow. Is there a question you wish I had asked that I've omitted?
You know, tonight we're talking about, tonight at least here in Italy, because it's 10 o'clock almost. But, as I said, we're talking about a very difficult and technical stuff. So it's difficult just to transmit to ordinary people what we are trying to say or what we are trying to transmit to the patient. But I think that overall, the most important message here is just that we have to take care of the patient from an holistic point of view. We have to take care of, we're talking about faces, of course, but as Luca said before, faces is our our card, our presenting card. So a lot of stuff starting from the faces just goes beyond and just gets to your soul, to your character, to how you deal with people, to how you talk always. For example, sometimes I see a lot of people that just change the ways of talking as how they refer to other people, how they refer to you. They're much more self-confident. That they change totally sometimes in their
I agree. Dr. Negrini agrees too, I see.
Yes, of course. Yeah.
Yes, and I am so grateful. I don't know if I can express how grateful I am. I know it's very late there, so just wanted to thank you so much for coming on my show. And I wish you a lot of success, and I cannot wait to have you here in Vegas. Please
Yeah.
do know
Yes.
I have a guest room if
Sure.
you're in Vegas. You don't
We-
have to.
We wish you
Yes,
luck.
you be my guest.
Thank you.
Thank you.
Thank you very much.
Thank
so
you.
much. Thank you so much. We'll keep
Thank
in
you.
touch.
Take care.
Buona notte,
Take
buona
care.
serata.
Bye.
Thank you so much.
Ciao.
Ciao.